I want to welcome everybody to the Mr. Medicare Show. We're here every Thursday evening, 7 o'clock Eastern Standard Time. We're here to talk about Medicare. So many questions out there about Medicare, so we're going to do our best to give you important information that will be useful. My name is Harold Solomon, Mr. Medicare. The Mr. Medicare Show is brought to you by the Senior Health Desk, 844-607-7283. I'm joined by Matthew Munster, one of the principals at the Senior Health Desk, and we're going to involve Mr. Munster to a great degree this week. This week, what we're going to try and do is just get a little different information out to you, but I thought before we jumped in, a lot's happened in the last week. So, Matt, tell me what's been going on with Senior Health Desk in the last week.
Yeah, so we're growing. We've added a few new members to the team. Our audience, so we'll have the opportunity to meet some of them within the next couple of weeks. I've invited them onto the show. Other than that, coming off a long weekend, so I hope everybody listening, watching on Facebook or YouTube had a good Labor Day weekend. And tomorrow I will be hopping on a flight to New York. It's my sister's 30th birthday, my mom's 60th, and my grandmother's 90th. So we're having a big party up there in New York for them.
I like the way you did that 30, 69. You guys planned that out?
Yeah, the Isosceles Triangle party.
Very good. Well, what we're going to do is, tonight we're going to talk about, should I change my Medicare Advantage plan? As we've been telling all of you, the annual enrollment period for the Medicare Advantage plans will begin October 15th, runs through December 7th. So it's an important topic, and we're going to get you as much information as we can. So if you're not sure whether or not it's time for you to look for a new Medicare Advantage plan, call 844-607-SAVE, S-A-V-E. That's 844-607-7283. So right now, our topic is, should I look for a new Medicare Advantage plan? So, Matt, what do you think? What should people do?
So yeah, just to piggyback off of what you just said, Mr. Medicare, you can also email us any questions at help@seniorhealthdesk.com. As we discuss every night on this show, or every week on this show, there's some things that we can't talk about just through email for privacy reasons. If that's the case, then we'll definitely schedule an appointment. Now, if you find the show helpful, informative, or highly entertaining, please hit the thumbs up on the bottom of the page and subscribe. This ensures you get the latest Medicare information from the Mr. Medicare Show. And if you have friends, family members, and neighbors that are Medicare age or soon to be Medicare age, don't be selfish. Click that share button and help us get the information out.
Very good. I do need to let everybody know that as licensed certified Medicare specialists, there are certain things that we cannot discuss on the show. Medicare has certain guidelines that we must follow. We do our best to discuss Medicare on the air. However, if your question falls into an area that we cannot discuss on the air, we will make time to call you, schedule a phone appointment so we can answer your question, and we'll make sure we get to the bottom of whatever your issues are. So tonight's topic is, should I change my Medicare Advantage plan? And one of the ways I thought we could do this was to go over the reasons maybe you should change, and then maybe the reasons maybe you shouldn't change. But let's start with the annual enrollment period's coming up. People have had their Medicare Advantage plan for a year, for 2021. They're looking for 2022. As an agent, and as I hear you train and Rich train the agents in the Senior Health Desk, what are the things you ask people, the questions, so you get the information so you can help them?
There's a lot, and there's not a one-size-fits-all. So we definitely have to go over the medications, make sure that you get proper prescription drug coverage. We also need to go over not only your primary care physician, but also all of your specialists to make sure that they're in network and you're not overpaying or even worse, going out of network and having to pay the full price. Now, one really, really big thing before we kind of start to get into the meat and potatoes of all of this is every single year, right, the Medicare Advantage plans, new ones come into the area, old ones leave the area, existing ones can change. And this is the time of year when all of that happens. And if it is happening to a plan that you're on, you should be receiving, if you haven't already yet, a letter from the insurance carrier just notifying you of whatever those changes are. So we'll get into kind of the meat and potatoes of, all the different reasons you may want to, at the very least, take a look at the different Advantage plan options this year. There's been a lot of movement, new carriers coming into the area depending on where you live. So you'll definitely want to look into that. They change every year. So you may as well just take a look, make sure you're in the right plan.
Now, I don't know about you, but I have gotten calls in the past. It'll be September, October, November. Someone's in a panic, and they say, I just found out, I went for a test, and they said, all of a sudden, I'm not covered, they're not in the network anymore. And I try and explain to them, as you said, this is kind of a ritual that goes on between the Medicare providers and the federal government because they're fighting for what it's going to cost for next year.
Right.
But some people get caught stuck in the middle of this.
Yeah, yeah, it's a big problem. I mean, at the end of the day, for a lot of you, your health insurance is really, really important. A lot of our clients are just living off of Social Security. They're on a fixed income, and if you're not in the right health plan, it can put you in a bad way financially. I've had situations, unfortunately, where it causes clients to not be able to afford a medication that the doctor says that they should be on. That's a big deal. So let's get into the meat and potatoes of this. Go over some reasons why you may want to look for a different Medicare Advantage plan this year. You want to start off, or?
Well, I just want to let people, for those of you that are just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, you can call 844-607-7283. You can check us out on Facebook. Just search Senior Health Desk. So someone's going to call in. We have our little calendar up. They can schedule a time between October 15th and December 7th. Mm-hmm. And we're going to ask them what plan were they on this year for 2021.
Of course.
And then we ask, or I do, and I'm sure you do, what worked well for you? And I always ask what didn't work well, because if it didn't work well, we have to know that.
Yeah, those are great questions.
Because we want to make sure that doesn't happen again next year. That's the service we, as an agent, provide. We're not just saying, take this, take this, take this. We want to make sure if they had an issue with a certain plan 2021, we want to make sure they don't have that issue for the next year.
Sure, yeah. No, we take our time. I've literally heard of agents walking into an appointment and only talking about the value-added benefits, the dental, the vision, the hearing, the gym memberships, the over-the-counter allowances, which, they're all great things, but they're not so great if the cost of your medication's tripled, right? So while all that stuff is good, you really want to, sit down with an agent that's going over everything, because there are good options out there for you. You just got to know how to look for those right options.
Well, some of the questions that we ask are, what are their doctors? We have to make sure doctors that they see on a regular basis are in their network, because, as I'm sure you know, sometimes doctors decide we don't want to be part of this network anymore.
Yeah.
And for the next year, even though you may have been going to that doctor for 10, 15, 20 years, if they're not part of your network, the plan does you absolutely no good.
Yeah, not only that, but let's flip that over, right? So let's say you were looking at a plan a year or two ago, and you're like, wow, this plan is really good. It's lowering the cost of my drugs a lot. It's giving me all the dental, vision, hearing I want. The copays are low. There's no deductible. But unfortunately, the doctor that you love wasn't in network. It may not hurt to take another look this year because you never know. The doctor may have joined the network this year.
Exactly. So what we try and do is we let people know when we ask questions, it's because the more information that we get, the better job we can do for them in planning. So sometimes many people are in very, very good health and they just have a primary care physician and maybe a heart doctor, a cardiologist, or a urologist, depending upon your situation. But we have some people that have pain doctors. Mm-hmm. And I know some of my clients, they've been going to the same doctor for 20 years and they're, I don't know if scared is the right word, but they're concerned if they don't see that same doctor because they've built up a level of confidence and trust.
Sure. And you know, a lot of those people, unfortunately, because of the opioid crisis in this country, a lot of plans require step therapy. So if you are, you know, a Medicare beneficiary on an Advantage plan and you've already been through step therapy and you're finally on whatever the pain medication is that helps you, you may, you know, and this is a reason why not to change plans. You may not want to change a plan because if it's with a new plan and a new carrier, they may want you to start from the beginning.
All over again.
Start with the more mild stuff before they get to the stronger stuff. Just some experience because I've had situations like that and people are not happy. So just be careful. If you are taking pain medication that's working for you, you know, ask your agent, hey, am I going to have to go through step therapy with this new plan before changing? Okay.
And also with the doctors, I tell my clients, sometimes they say, I've been going to this one doctor, but they're very far away, mm-hmm. and a plan has many other doctors within the network. So we always let people know, well, there's someone 3 miles from you, 2 miles from you. Because sometimes if you're traveling very far and it's a big inconvenience or you need a family member or friends to get you to and from, all these little things that an agent can bring to the table will make life easier, not only for that individual, but all the other people that are helping them come in.
Sure. I mean, I spoke to a gentleman in Ohio, must have been 2 weeks ago. He's like, I love my doctor. I love my doctor. I love my doctor. I don't want to change my plan. His doctor is an hour and a half away, so he only, you know, pulls himself up by the bootstraps once a year to make the trip out to see the doctor. And like, I told him, is like, listen, I'm happy that you like that doctor, but you know, if you're only able to get there once a year because it's a far travel, doesn't really matter how great the doctor is. We ended up helping out with a plan. His new doctor is literally half a mile away from him, and he's happy. You know, he still sees that same old doctor, but he's getting done the things that he needs to get done. Medicare has learned that to avoid expensive medical bills, preventative care is the key. So whether that's, you know, getting your routine dental checkups, going to your primary care physician for your annual checkups, going to your specialist, taking your all of that stuff is very important. Make sure that you do it.
If you're just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can find us on Facebook. I understand we're going to be on YouTube soon, maybe even TikTok. You'll be doing some crazy dancing to entertain everybody.
I don't know about dancing, but this show will be on YouTube. So if you're listening on YouTube, thank you for or watching on YouTube. Thank you for being a part of our first YouTube show.
And if you have any creative ideas, you can email Senior Health Desk and let Matt know or Rich know if there's a song or a dance you want them to talk about Medicare to. I'm sure they'll be happy to do that. It won't be a problem. So getting back to the point of, should I change my Medicare plan? It's not a question of, as you said, black and white. Stick with what you have or just change. So many changes happen year to year. Doctors in network, hospitals in network, HMO plans, PPO plans. medicines, now prescriptions. To me, that's a very, very big part of someone's
Sure.
health care.
Absolutely.
And when you're thinking about should I change my Advantage plan, I believe that prescription drugs are a major part of that.
Yeah, because just like I was saying before, it's great that a plan has dental, vision, and hearing, but if the cost of your drugs goes up from $100 a month to $400 a month, I can tell you, if there is a dental plan out there that costs $300 a month, which it doesn't, it's going to be phenomenal. My point is that you're better off doing away with the dental and making sure that your prescription drugs are properly covered. That's the number one thing, because with that savings, you can pay cash at the dentist, right? So you really, if you are taking, brand name prescription drugs that, the copays are a little bit high, it's definitely something that we want to pay attention to. That would be the very first thing.
Now, we're always going to ask you when you call and you schedule your time. Hopefully, you'll be going to the website soon, because October 15th is only, 5 weeks away now.
Yeah.
The start of the annual enrollment period. Schedule some time with us, because I find a lot of people, even from the beginning of this year to when I talk to them October, November, their prescriptions have changed. They started with 7, but they got a little better.
Right.
Now they're only on 5. Or maybe they were on 3 and something happened, and now they have 6, and the 3 that were covered originally were covered well, but the new 3 are now a problem.
Yep.
And if you keep that same plan, then you're going to have the same problem for next year. So it's very important that we go over your prescription drug list with you, because we have to make sure that whatever plan you're on, your doctors are all covered and they're all in network, and your prescriptions are all covered and you're all in network. Now, beyond that, and as you alluded to before, this is what I think they throw in all those commercials everybody's going to be seeing on TV.
Yeah, Joe Namath, J.J. Walker, all the good stuff.
They talk about value-added benefits, and what that means is dental, vision, hearing, transportation to and from your doctor's office, silver sneakers, generic term now for gym membership, over-the-counter allowances, telehealth visits. And one thing that has happened over the last few years due to this COVID situation is televisits were, I think, not understood too well by the older people. How could I get help from my doctor if I don't see my doctor? But now you realize it's working out fairly well.
Yeah, and especially because of COVID, it's becoming really, really popular, and it's allowing people that normally wouldn't be able to get to their doctor to still have a visit and still get a checkup. Just wanted to take a moment for a second, go back to the prescription drug coverage. There's 2 things that we missed that I wanted to make sure that we relayed. So, number one, if your prescription drug plan or Medicare Advantage plan has a deductible, what that means is that right at the beginning of the year, if you're taking expensive medications, or you have doctor visits right at the beginning of the year, and you're noticing and usually high prices, it's almost like you don't have coverage. That's because you have a deductible on your plan. That's one reason why you may want to look for a different plan. I truly do my best to find Medicare Advantage plans that don't have a deductible, and that way, right from the beginning, you're not paying large deductibles. You just pay small copays. Sometimes if we find, the right Advantage plan, it might be a $0 copay. And then the second thing that I wanted to mention is, and I want to be careful and not mention insurance carrier names, because I think that's a no-no. But there's been a lot of movement as far as companies buying other companies, and just a lot of changes. So one of the things that I noticed just in the last couple of years is one company buying another, and then all of a sudden my client's getting a letter in the mail saying that, hey, your Advantage plan or your prescription drug plan is going up from $25 a month to I had one client who was above $70 a month. So it was almost a 3 times increase. So if you get anything like that, definitely another reason to look at your options, because what that means is that plan is no longer the same plan that it was when you first enrolled. Okay, and sorry to backtrack, but I thought that was important. Wanted to get that out there.
That's not a problem. For those of you just tuning in, you are listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. Find us on Facebook, YouTube, TikTok. We'll be everywhere. So let's get back a moment to the value-added benefits. So what people tell me, they're watching TV, and the commercial comes on, and as closer as we get to October 15th, these commercials are going to be on 700 times a day, over and over and over and over again. But what happens is people hear first, this is a $0 plan that catches their attention, and you're going to get dental, vision, hearing, transportation, gym membership, over-the-counter, televisits. We're going to come out and cook and clean and make your bed, and they make
Right.
all these promises. But if you read on the bottom, scrolling on the bottom, it says some of these may be available in your area. So we have to be very, very, very careful.
And then not only that, but okay, great. A plan includes dental, right? Maybe your plan does include dental. Well, are they giving you $500 a year to spend on dental, or are they giving you $2,500 a year to spend on dental? Because there are plans out there that will give you more dental coverage. Same thing with the over-the-counter allowances. Are you getting $25 a month, or are you getting $100 a month? There are big differences between one company and another when it comes to the amount of a value-added benefit that they're giving you. It's worth looking into.
That's one of the reasons, as an agent, we pride ourselves in finding the best value for all of our clients. In talking to our clients, I always try and ask questions and then listen. I ask, how are your teeth? Do you have any dental issues? And sometimes people are fortunate and they say, no, I've got good teeth, gums are good, don't really have a problem. But then they might say, but my eyesight is not too good, or my hearing is not too good. Then I know they don't need as much dental, but vision or hearing.
And those hearing aids can get. Before I started doing this 6 years ago, I did not realize how expensive hearing aids were.
Oh, yes, sir.
Yeah, it's incredible.
When we go over your plan for these value-added benefits, dental, vision, and hearing, as Matt said a moment ago, you could have 6 different Advantage plans in your area, and all 6 could cover dental differently. Some have minimal coverage, a free cleaning, 2 sets of x-rays, and then the rest is out of your pocket, copays and deductibles. There are other plans that have major dental covered. They have fillings covered. They have x-rays covered, possibly even implants if you need it. It all depends on what's necessary. Then also, transportation is touted. Transportation is available in some cases, but again, you have to read the fine print. It's not.
Because there are limits.
It's not unlimited, exactly.
Yeah.
You can't say, I want to go to a doctor every 2 weeks and expect someone to come and pick you up and bring you back. So be careful. Yes, if you need that, and a lot of people do, they're on their own. Kids can't help, family can't help. It's very important. Just make sure, do you get 24 trips? Now, is 24 trips 24 days, or is it 24
one-way trips?
One-way trips, exactly. So you have to make sure you know what you're doing. Now, the gym membership is relatively straightforward. A lot of people say silver sneakers. That, I think, was just a name attached to it. But that's a gym membership, and many Advantage plans in just about every area has
Yeah.
some kind of an arrangement with a local.
And so Silver Sneakers is great. I was the first time I looked at the gyms that were covered under Silver Sneakers, I was truly amazed because they cover a lot of like big brand name gyms too. You know, as you can see, you know, there's a lot that goes into it, and what I found is that it's not really right to expect that, you know, you, the Medicare beneficiary, knows the type of things that you need to look for in these plans. That's why we're here. That's why there are insurance agents. That's why there are, you know, people that have to pass exams to become AHIP certified to really, really understand this stuff. So that kind of brings me back to an overall point that actually one of my clients told me the other day, and that's where I got it from. He said, your insurance is only as good as your insurance agent. And that's something that I kind of took and put in my back pocket because it's true, right? And on that note, when you do call in or set an appointment and we're talking about these plans, the more you tell us, the better job we're gonna do at finding you a plan that really, really fits your needs. You know, there are a lot of plans available. You know, so talk to us. We're here for you. Yeah.
Let's go over the over-the-counter allowances. Many plans now, in an effort to have people join their particular plan, have an over-the-counter allowance. Now, it varies greatly. I've seen some Medicare Advantage plans where you get $25 a quarter.
Right.
I've seen some $75 a quarter. I've seen some like $1,000 for the whole year, however it's broken up.
Some of the dual special needs plans, which, you know, if you have both Medicare and Medicaid, there are specific types of Medicare Advantage plans that are built for you. I've seen a lot of those with like real heavy over-the-counter allowances, like $300 a quarter, which is nothing to sneeze at. I mean, that's $100 a month. That can go a long way.
Especially for those people in the dual special needs plans, they need all these things due to their circumstances. Lastly, the televisits. When COVID hit, most of my Medicare clients always felt a little on the fringe because family's busy, everybody's busy, but they could get out and move around. Once COVID hit in lockdowns, people were in a bad way mentally and emotionally. Televisits are an excellent way to have someone you can reach out to and talk to about how I feel and what's going on, and they may help you get through this. So I think the televisits are something that I'm going to be looking for all of my clients.
Absolutely.
For next year.
Absolutely. And you know, on that note, you know, whether it's televisits, whether it's avoiding a deductible, whether you've had a change to the current plan that you're on, or you are taking a new medication or seeing a new doctor, there are a lot of reasons why you should be looking for a different Advantage plan, or at the very least looking at your options and making sure that the plan that you're on is still the best one for you. So we've gotten great reactions from the show and the YouTube channel and the radio show on iHeartRadio. Our spots are filling up very quickly. So if you want to have an appointment, go to seniorhealthdesk.com. It's a private one-on-one appointment. When you go to our website, seniorhealthdesk.com, you're going to see right at the top of the page, schedule your appointment for AEP. You click that link, it opens up a calendar. All you have to do is just put your name, your phone number, and the day and time that you want us to give you a call, and that's as simple as it. And then we'll kind of take it from there, and we'll take all the time that you need to make sure that we put you in the best plan for you starting next year, January 1st.
If you're just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also check us out on Facebook. The reason we're doing this is we want everybody to know as Medicare agents, we want to make sure you get the best plan at the best price with the most benefits available. Next week, we're going to discuss HMOs versus PPOs, and those are whole worlds unto themselves. If you have any questions about next week's show, HMOs versus PPOs, go to help@seniorhealthdesk.com, and we'll bring those topics up as we discuss the pros and cons of HMOs versus PPOs.
Yep. And yeah, if you find the show helpful, informative, or highly entertaining, please hit the thumbs up on the bottom of the page and subscribe. That ensures that you get the latest Medicare information from the Mr. Medicare Show. If you have friends, family members, and neighbors that are of Medicare age or coming up on Medicare age, don't keep us all to yourself. Click that share button and help us get the information out.
You can give us a call at 844-607-7283. Say you listen to the Mr. Medicare Show, and if you have a question that you need answered, or you need to schedule a free Medicare evaluation, or you want to schedule time for next year 2022's Medicare Advantage plans, please go, as Matt said, and do that. But if you do call and the lines are busy, please leave a detailed message and someone will return your call as soon as possible. If you belong to an organization, a business, or any large group of Medicare-aged individuals, you can call and schedule a workshop or seminar. I've gone out to so many different places, spoken to 25 people, 40 people, 50 people. When you get everybody in the room at the same time, got to be careful with COVID, masking, and all that. We'll do the best that we can. But a lot of times the question one person asks is the same question another 10 people are going to ask. So we can take care of a lot of questions, a lot of issues, get a lot of information out there in a seminar or a workshop. So our goal is to educate and inform you about Medicare. We want all of our Medicare clients to enjoy your life. Hopefully we're going to get through this COVID season. I never know. It's good, it's bad. It's getting better, it's getting worse. I never know when I wake up what situation we're going to be in. But together, as agents working with you, we will make sure you have the best coverage at the best price. We will take care of that for you.
Yeah, we want to help as many people as we can. So again, please share this information with family and friends so they can join us. Every Thursday is when we premiere this video and when it goes live on iHeartRadio. And I just wanted to, with the last few seconds we have, Mr. Medicare, listen, if you go into this annual enrollment period and you're dealing with an agent or an agency or an insurance company and you feel like you're being sold, it's probably because it's being done wrong. We don't sell policies. We facilitate enrollments, and we help you understand the information so that you can make an educated decision on your own. We help you with that as the experts, but ultimately it's your decision. So please give us a call, seniorhealthdesk.com. Thank you again for spending this time with us, and we'll talk again next Thursday. Have a good one. Bye.
Bye-bye.